So, thyroid is intimately involved with all hormone function. Thyroid is your metabolism to some degree and also has some function as it relates to your thermostat or your temperature gauge. And so, your female hormones do not function in isolation. When they're changing, it affects other hormones in the body, which are trying to then compensate and regulate and keep the status quo. The body is a very smart machine that has lots of, gaps and ways to continue to help prevent decline in how you feel, but we frequently will see that the thyroid hormone will start to fluctuate during the time that women start to go through perimenopause as a compensatory mechanism for hormone fluctuation. Certainly, women in general are at very high risk for thyroid disorder. I would say about a third of women in the United States do suffer from thyroid disease of some kind, the most common of which is Hashimoto's hypothyroidism, which is an autoimmune form of thyroid disease. And hypothyroidism means low functioning thyroid. So the amount of hormone that your thyroid is making is very low. And so this can frequently cause symptoms that frequently overlap with many of the symptoms of low estrogen and low progesterone. So, for instance, increase in weight or resistance to weight loss, temperature regulation issues, either can't tolerate the heat or can't tolerate the cold well. We can see dry skin, we can see hair loss, we can see mood disorders like anxiety or depression, and you can see bowel habit changes such as constipation when patients have a low functioning thyroid. So it is very important that you have your thyroid checked at least once a year and sometimes more often depending on risk factors and symptoms. And so I frequently will order a thyroid panel test to look in conjunction with your female hormones to determine whether there is a thyroid condition.